The systematic destruction of health facilities and blockade on essential medical supplies has allowed for the rapid and wide spread of infectious diseases across the state. Gabru Leggese, Director for Animal Health in the Bureau of Agriculture and Rural Development, says the siege has resulted in a severe lack of essential medical supplies, especially vaccination for animals, resulting in the recorded deaths of more than 38,000 animals and close to 250,000 animals contracting diseases.
This year, because of the blockade, we have not been able to compile sufficient information, but from some of the districts where we have been able to collect information, we have been able to track some 241,710 animals that have contracted some type of illnesses, and so 38,800 animals have died. This is very high.
Gabru says the impact of the lack of vaccination for animals can be clearly demonstrated in how anthrax has been able to spread so rapidly, saying that over the last 10 years, the state had only recorded 100 cases of the bacteria, but has now recorded 205,000 cases in just a number of districts.
Anthrax is one among the diseases that continues to be a threat. Based on a series of assessments conducted over the past 10 years, not more than 100 animals had contracted anthrax. But now, in just a number of districts, we have been able to record more 2,500 cases in 227 days.
Gabru says that the animal health system in Tigray was mainly focused on prevention, with the system managing to vaccinate some 19 million animals in 2020 alone. But this year, due to the siege, Gabru says it's not been able to vaccinate even for 1 million.
Back in 2020, when movement was limited due to COVID, it was possible to vaccinate more than 19 million animals. This is as part of prevention. More so, we were even able to treat sick animals. Despite challenges, we had hopes of delivering 10 million doses of vaccines with the help of different organizations, but we have only given 3.7 million doses.
Gabru also says that frequent power outages have resulted in vaccinations going out of use due to lack of refrigerated storage.
The vaccines that we had are leftovers from the previous years. We have lost all the medications and vaccines that we had in different districts across Tigray. The vaccines need to be stored in a cool environment, but power has not been available in some of those districts for a year.
A deliberate and systematic blockade on essentials coming into Tigray continues to result in the rise of easily preventable and curable diseases, leading to the death of many.